You said who?
Okay, we're here to do trach care on this patient.
Oh.
I have verified in his chart that he needs trach care because he has a trach in place. I have came to the room, washed my hands, introduced myself to the patient and family, explained to them what we're going to be doing, and asked their understanding. And they said yes, so I have my gloves on. Going to assess the patient's listen to their breathing, evaluate for suctioning. Suction before we do the trach cleaning, so we don't have to repeat it when they snot it all up again. So I have my sterile water and my hydrogen peroxide and my trach care kit. Going to open it, take out my sterile field, touching it only in the corners. Dump everything out. Going to make a peroxide sterile water mix. Sterile water. Going to take this stuff off because it's nasty and we're going to replace it. Then I'm going to put on my sterile gloves again. For like the 4th time. Move this to the side. I can use it for my trash. I'm going to lay out my equipment. I'm going to put 3 of these in the hydrogen peroxide water mix. Some of those in the other one, in the water. It's always important to have extra if you dump it like that. A new drainage gauze, pipe cleaners, brush. Okay, so I'm going to take my sterile gauze and dip it in the hydrogen peroxide. I'm going to clean away from the stoma, getting all the big stuff away and off so we don't have to worry about it. I'm going to take a cotton tip applicator, clean away from the stoma, 1 swipe. Then I'm going to do it again with another one. Throw that in the trash. Going to take a sterile water and clean off the peroxide. I'm going to take out his inner cannula and place it in the sterile water peroxide mix, and going to put in a disposable one. I'm going to clamp that on there. Going to take my brush, clean the outside and the inside very well, scrub it, get all the gunk off. Going to take my pipe cleaner, scrub the inside. Going to rinse it in the sterile water. Going to take a sterile gauze and wipe the outside dry, used by other, and I'm going to dry the inside. Going to take the disposable one off, throw it away, insert this one back in. Going to check the stoma to see if it looks infected, if I need to put any antibacterial ointment on, and I don't. So I'm going to gently replace the drainage gauze, and I'm going to make sure that it's flat and there's not any creases to make pressure sores. Nice and pretty. Going to run this new thing around his neck. Going to make sure that this stays stabilized while I take this one off. Would be good to have forceps here so you can get it. You don't want to tie it in a bow knot because you don't want them to be able to untie it, so tie it loosely around. I'm going to put this under the patient's neck. tie the other one. Doesn't sound very good. Going to tie it to where you have 2 fingers loose on the outside. You don't want to tie a knot near the carotid artery, so tie it close to the flange or behind the ear. And you take off all your gloves and you dispose of everything properly. Questions?
How frequently should trach care be performed?
Should be performed daily and then as needed.
How do you adapt a manual resuscitator to fit a metal trach?
It has a special adapter since it doesn't have the traditional 15mm adapter on there. You have to use the adapter in order to plug it into the back.
Identify 2 different systems that allow tracheostomy patients to speak.
The passimieri valve and the speakeasy valve.
What are 3 complications associated with tracheotomy?
Infection, pneumothorax, and subcutaneous emphysema.
Describe the purpose of the obturator.
The obturator is placed into the outer cannula when the tracheostomy is initially placed, so it rounds out the end of it and it doesn't scoop the trachea, causing trachea damage.